Hi, everybody. It's Dr. Patricia Coughlin talking to you about all kinds of tips and research and practices that can help you get better at what you do as a psychotherapist. How do we track our progress? How do we evaluate outcome? This is something that goes way back, actually, this question and how to do it. And David Mallon, a psychiatrist from the UK, started this process of evaluating psychotherapy outcome back in the 50s in Tavistock Clinic. When he became aware of Davinlou's work, he flew to Montreal and watched all of Davinlou's tapes and then invited the patients in for an in-depth follow-up interview to assess where they were now vis-a-vis their presenting complaints. And what he found was that the patients who had responded to treatment were not only continuing to maintain their gains, but they had actually gotten even better than they were at follow-up. They continued to grow and progress and develop after the treatment ended with no additional intervention. So that was pretty amazing, and those kinds of results have been replicated with ISTDP. So how can you track your own progress? I know there's a lot of emphasis and pressure on clinicians, especially if you're working in any kind of public setting or clinic, to evaluate your psychotherapies with paper and pencil tests or iPads at this point. Often they're required every time the patient comes in, and they're evaluating whether they're happy with what's going on, whether they've been able to talk about what they wanted to talk about, and things like this. Unfortunately, there's quite a lot of data from the NHS and even in medical specialties that evaluating practitioners in this way, having patients give a report card on a weekly basis, actually has a lot of negative unintended consequences. First of all, it doesn't accurately reflect the very bumpy, erratic course of change in most human beings and, in fact, in most complex systems. Our patients come in stuck, embedded in certain patterns of behavior and reactions that have to be disrupted before they can be reorganized. And that's a difficult and often upsetting process. So if you expect or are somehow being demanded to have linear change where everything is smooth and in an upward trajectory, when somebody has a negative score, you're going to think something is wrong, and you might actually back off or stop having the difficult conversations we actually have to have with patients to help them face rather than avoid their conflicts. Again, in the research done in the NHS, they found out that doctors and practitioners started to weed out and not want to see difficult or complex patients because it would bring their scores down. And so they started to get preoccupied with their own ratings rather than what was actually happening with the patient. So I'm sure we all agree we don't want to fall into that trap. So I have followed Mallon's lead and his advice. I videotape all my sessions, and I can't emphasize enough how important that is. You just don't see what you don't see. You don't hear what you don't hear when you're in the session. So having sessions to review, to get clarity on what is and isn't happening in the session is going to help you enormously. Also, you can take it for supervision if you need to. But the other thing that's absolutely crucial, and I don't think enough people are doing this, and that is follow-up. I do 1 year, 5 year, and 10-year follow-up. In fact, I even have 20 and 30-year follow-up on patients now. So I call them in, and actually I don't charge for those follow-up sessions because I'm asking for them, not the patient. And I speak to them about what is happening in their life, specifically focusing on the areas of difficulty that brought them in. And just like Malin, I want to be able to see that symptoms have not simply been removed or reduced, but actually replaced with something healthy, so that someone who's been depressed has realistic hope, someone who's been isolated is actively engaged. And it's particularly important to assess whether the person is able to deal with the very kinds of things that would have gotten them in trouble in the past in a new and healthier way. So, for example, the woman with ulcerative colitis, who I think I call the good girl in my books, I have a very extensive follow-up on her. And not only was her disease, did it go completely into remission with no need for medication, but it didn't flare up with the trigger event, which was a sudden death of a loved one. So in fact, in the 10 years after our treatment ended, there were several of those. Her sister was suddenly killed in a horrible bike accident. Her beloved stepfather died, and her father-in-law died. And in all cases, she was able to just navigate the process of grief without any flare-up in symptoms, without getting depressed, and in fact, with feeling as if, especially with her sister, she said, it's a rich, complex relationship, and it continues. I mean, so even though her sister is physically no longer on the planet, she still has a relationship with her. And it's a healthy relationship, unlike the way it was when she first came in to work with me. It was quite a contentious and competitive relationship. So again, I'm going to just really urge you to videotape your sessions, to watch them, and to do follow-up. There's no other way to know whether your treatments are really being effective in the long run, and that's what we want. We don't want people just feeling better when they finish, but 5-10 years out. So please consider that. It's a very rich and rewarding experience, and I'm telling you, to hear about what people are able to do with their lives when they're freed up is just amazing and incredibly heartwarming. I mean, people write novels and create charities and, just do all kinds of remarkable things in the world. So please consider adding this to your practice. It will be good for you and good for your patients. Thanks. More later.